This week's Women's Care Wednesday, Dr. Ryan Brosch from Women's Care Florida is back to help us understand. This morning we're focusing on endometriosis and how it can be treated. We have a lot of questions here this morning. So good to see you. Welcome back.
Thanks, Carly. I appreciate it.
So endometriosis, my first thought is I feel like I know a lot of family members and friends that have maybe struggled through this. I feel like it's pretty common, but what say you, doctor?
It is. It's a very common condition, unfortunately. Reproductive age women, about 1 in 10 are going to experience endometriosis.
And what age are we talking about? Is this something that, women can get pretty early on? Does it happen more often in older patients?
Absolutely. I mean, as soon as you start menstruating and you start having periods, up until you stop, you could experience endometriosis. So we're talking about the range of like 14 to into your 50s.
Now, one of the interesting things about it is actually getting that diagnosis, which I understand is kind of difficult to do. So you may not know you have it probably until you've been suffering with it for a couple of years, right?
Yeah, and unfortunately there's a lot of other things that could cause symptoms that are similar to endometriosis, and so sometimes it's hard to make that diagnosis. Patients may experience very severe chronic cyclical pelvic pain, especially that gets worse during menstruation.
Okay.
They may also
Is that the biggest kind of symptom of it?
One of the most common ones. Pain is essentially is the most common.
And how are you going to know?
So many other things can cause it as well. And then some patients will also experience issues with intercourse, discomfort with intercourse, and then some people that have very severe endometriosis may also have symptoms with increased pain with urination and increased pain with bowel movements, especially around when they're having their cycles.
Well, and explain, I guess we should have done this first, maybe what exactly is endometriosis? What is actually going on?
Sure. Endometriosis essentially is endometrial tissue, which should only be inside the uterus. Unfortunately, it's gotten out of the uterus into the pelvis, and that can affect the fallopian tubes, the ovaries, the uterus, the bladder, even sit on top of the colon, and it causes a lot of inflammation and discomfort during cycles, and it can even cause scar tissue and sticky adhesions to form between those different organs, which can affect their function and can give patients a lot of pain afterwards.
And I know this is a big issue when it comes to fertility as well.
Yeah, unfortunately those implants that can sit on top of the fallopian tubes can actually affect the fallopian tube's ability to transport egg and sperm into the uterus and have a natural embryo form there.
Once you have endometriosis, do you have it for the rest of your life? Is it something that you have to constantly watch? I mean, talk about treatment options for women, again, either have just been recently diagnosed or maybe going, hey, I think I might have this.
Sure. When you come into your gynecologist's office, the patient may be experiencing some of those symptoms of endometriosis, and your gynecologist likely is going to do a pelvic exam for you, potentially offer you a pelvic ultrasound, and then after that, they're probably going to recommend hormonal suppression with, for instance, birth control pills, which are first line for the disorder. And that may occur even before you get an official diagnosis of endometriosis.
Will hormones help shrink the tissue? I mean, what is the hope there? Yeah,
the hormones help to decrease the amount of natural estrogen and progesterone being produced by the ovaries, which are that's what's stimulating those endometrial implants on top of the rest of your organs to flare up and cause pain.
All right, we have a little less than a minute left. What is your take home? Do you think, again, I think a lot of women, can relate to this, struggle with this. What's your take home?
My take home is if you have extremely painful periods or you're having unusual symptoms, like you're having a lot of issues with pain with urination or even pain with bowel movements, especially that seem to get worse around your cycles, that's not normal. And definitely I'd want you to go in and speak with your gynecologist about potentially getting started on some.
And there is good treatment options? Is there hope for these patients?
Absolutely. Most of my patients I'm able to control with medications alone, and those patients that aren't well responding to medications, I offer diagnostic surgery as well.
Okay. Doctor, thank you so much for coming in this morning. We learned a lot from you. We appreciate it. We hope you come back soon. If you have any questions, it's very easy to get a hold of him and his team. Of course, we've been showing the contact information, but there is the website as well. But again, thank you, doctor.
Thank you, Carly.